Okay, so this is the artery video, and we're going to go over the different arteries. So let's break out the skewer. So right here, that is the arch of the aorta right there, okay? The first branch off of the arch of the aorta is the brachiocephalic artery. Okay, the brachiocephalic artery, from here, it goes underneath this vein right here, the brachiocephalic vein, and splits into the right common carotid artery and the right subclavian artery. But this first branch is the brachiocephalic artery. Second branch is the left common carotid artery, which is this artery here. The third branch is the left subclavian artery. And you can remember it ABCs. A, aortic arch. B, brachiocephalic artery. C, common carotid artery. S, subclavian. Okay? Now the intercostal arteries you cannot see on this model, which is fine, no big deal. And then we're going to go to the abdominal aorta. So as you see, the aorta has the arch, and then it goes down. It goes behind the heart, behind the liver, and here it reappears. So the first branch off the abdominal aorta is this area here. That is the cephalic trunk. The cephalic trunk has three main arteries. You have the common hepatic artery that goes to the liver. You have the splenic artery that goes to the spleen. And then this kind of looks like it doesn't really go anywhere, but this is supposed to be the left gastric artery. Okay, but the stomach is out of here, so we don't have it connecting to anything. This artery right here, see right there, that is the superior mesenteric artery, and the superior mesenteric artery goes to the most of the small intestine and the first part of the large intestine. Then you've got these renal arteries that go to the kidney. That's pretty easy. And then you have this artery here. This is the inferior mesenteric artery, and it goes to the last part of the large intestine. Then right here, you've got the bifurcation of the aorta, and you've got the middle sacral artery, sometimes called the median sacral artery, and it goes to the sacrum, which is this bone behind the artery here. Okay? Now, let's go up here, and I want to show you all the head and neck circulation. So here is a common carotid artery. The common carotid artery turns into the external artery. Now, normally the external artery is going to give this extension here, and that's called the facial artery, which makes sense because it goes to the face. You also have this artery here called the superficial temporal artery, and it goes to the temple, which is the area behind the eyes. It's just not demonstrated as well on this model, but I mean, it's still superficial temporal artery, okay? And you can't really tell the internal carotid artery on this model, so we're not even going to worry about that, but just know that this is the common carotid part, and then it turns into the external carotid artery, which would be like this part right here, okay? The vertebral artery is not on this model, but it would be going through the transverse foramina of the the vertebrae of the neck, the cervical vertebrae, okay? Now, in the arm is easy. Subclavian is the first part because it's under the clavicle, subclavian. As it goes through, when it hits the armpit, it's called the axillary artery because it's where the axilla is. Then we're going down the arm. As it goes down the arm, that turns into the brachial artery. And then the brachial artery splits into the radial artery, which goes along the radius, the thumb side of the body, right there. And then you've got this part here called the ulnar artery because that goes along the ulna bone, okay? Now let's go back over here to the lower arterial circulation. The first branch off the bifurcation of the aorta, when it splits, is called the common iliac artery, okay? So these are the common iliac arteries, okay? The next branch or bifurcation is the external iliac artery, and the internal iliac artery. External iliac artery, internal iliac artery. I cannot emphasize that enough. I see so many people get that wrong. The first break, that's the common iliac. Second break, external iliac, internal iliac. External iliac, internal iliac. Now as we go down, this major thick artery that goes along the femur, that's the femoral artery, okay? As it continues along, it's going to go behind the kneecap, and that's called the popliteal artery, because, as I'm sure y'all remember, the popliteal area is the area behind the kneecap. And then it splits into the anterior tibial artery, which is this artery here. It's in front of the tibia. And then the posterior tibial artery, which goes behind the tibia. And it kind of comes up here. It actually goes where the medial malleolus is, and you actually have a pulse here. And the artery, the anterior tibial artery, goes on top of the foot, and so it becomes the dorsalis pedis artery, which is right here. And that is the arterial circulation.